I walked in, they told me, I thought I was going to give a welcome address. Then they told me you must speak about our chief guest, Sir Mailwaganan. Then I said, okay, I'll speak. They thrust a paper in me. If you speak about him, you speak volume. There's no time. For pages and pages I had to read. Then they gave me a small paper, the gist of what I have. It's a minuscule of his major achievement, which I'm going to read. Dr. Mailwaganan, his name is synonymous with orthopedics. He is recognized by his pioneering work in orthopedic oncology. And oncology was at its infancy. He had come in and did a major work. He introduced the concept of limb salvage surgery. I still remember that those days, if there is any tumor, osteogenesis sarcoma, again, I myself had done a lot of below knee amputation. I still remember about 30, 40 years ago. His personal series of more than mind-boggling 1,700 cases of custom mega processes is the largest number by a single person. He's a giant. Not only looking at him in the field, also he's a giant. He has received 3 national awards from none other than Thiru Abdul Kalam, the famous President of India. B.C. Roy Award, National Award for Welfare of the Disabled in 2005, and Padma Shri Award. Kudos to him. Internationally also, he has gone beyond overseas. The first Indian to be the president of the Asian Pacific Musculoskeletal Tumor Society. It's a really rare honor. The Royal College of Surgeons of England conferred the fellowship. I also struggled and got it at last, but it got it because they recognize his value. And in fact, Royal College got that pride by bestowing this award on him rather than the reverse. The British Orthopedic Association honored him with the honorary fellowship as well. Kudos to you, sir. Padma Shri, Sri Dr. Mailwaganan Nadarajan was the 7th Vice Chancellor. He was supposed to be my classmate. Unfortunately, I missed 1 year and he became 1 year senior. And really, even today, I feel I missed the opportunity to be with him. He was the director of Institute of Orthopedic and Traumatology. His father was a dean. And his father was also the head of the department. Those days, the directorship was not there. But his father, when I was doing my second year, he was the dean of Madras Medical College. So this is the short brief about Dr. Mailwaganan. Much more to talk about, but since the time is not permitting, I'm cutting short here. Do I speak welcome address? Right. My dear friends, it's a real honor bestowed upon me to give the opportunity, the chance to welcome the doyen, Dr. Mailwaganan. As I told you, his name is synonymous with orthopedic surgery. Very simple man, down to earth. He doesn't throw his weight around. In fact, his father was the dean, Madras Medical College, when I did my second year. Magan Tandai Katrum Udavi, Ivan Tandai Yannotran Kollenum Sol. Tandai Manakatrum Nandri, Avayirthu Mundirpachayal. That's what he has done it. I am sure his father will be happy. From his heaven, he is smiling upon him. I still remember when I was in second year, his father was he was occupying both director of both head of the department of orthopedics as well as the dean Madras Medical College. That at the time I was coming up, in fact, I still remember he encouraged me to take up the physical work. I joined NCC. He gave me extra time. And in fact, he had given me attendance as well But for him, I would not have completed my parachute training, or I would not have become All India Best Cadet. Thanks to him. And I must tell you one thing, when this function was being organized, and when they told me that Mailwan is there, and told him, look, come on, I must be there to welcome him. And I'm really glad I'm given this opportunity. In fact, today's inauguration of the robotic, I asked my son, should we need a robotic? Our surgeons are good, they're precise, they got a very good hand in surgery, and why do you want to spend extra money? He told me, what did he tell me? He told me, Dad, you are good, you are doing excellent work, and you are a fine gentleman, but when mother is around, you are much more, you are like a robo, you're doing everything precisely. That's why we need robo. I understood. Most of the married men will understand that. So I welcome him in our midst today to be with us and inaugurate the robotic operation of the equipment in orthopedic surgery. Thank you so much.